This is the third time Mohammed Ismail has hovered over his youngest son, Abdullah, and listened to his cries as he's treated for skin lesions on his face and body. Abdullah and his two brothers have leishmania, a parasitic skin disease spread by sandflies. It's experienced a resurgence in Syria, as living conditions have deteriorated during the country's 7-year war. Mr. Ismail and his family woke up before sunrise and traveled 2 hours over rubble-filled roads to get to this clinic in Raqqa, the former Islamic State stronghold. They waited for hours in a crowded waiting room. In a country devastated by years of conflict that now faces a gaping hole in its healthcare system, they had no other choice. Before the war, Syria had hundreds of public and private hospitals. Medicine was inexpensive and accessible, and the infant mortality rate was one of the lowest in the Middle East. But human rights activists and aid groups say President Bashar al-Assad's regime and its allies have deliberately targeted civilians and hospitals, including the recent alleged chemical weapons attack, in an attempt to destroy the infrastructure and weaken opposition control, a claim the regime has denied. According to the United Nations, about 3/4 of Syrian healthcare workers have fled the country, and more than half of public hospitals and health centers are either closed or only partially functioning. In their place are a handful of makeshift clinics like this one, where doctors struggle to treat the most basic illnesses and chronic conditions.
Diabetes needs a stable environment. Hypertension, cardiac problems, obstetric emergencies needs good antenatal care, and these have all been interrupted in the period of active conflict. And so we're seeing cases that are worse than we might imagine.
Childhood vaccinations have also been disrupted. Doctors say they're now seeing diseases that had mostly been eliminated, like measles, mumps, and polio. And with millions of Syrians displaced, posters for vaccination campaigns have done little to help get the word out. So on weekday mornings, Mahmoud Abu Ahmad, a former science teacher, walks the streets, megaphone in hand, urging parents to vaccinate their children. It's estimated that more than 450,000 people have been killed in the Syrian conflict. But that number accounts mostly for those killed in the fighting. A World Bank report says more may have died from the breakdown of the country's health system than from any bullets, bombs, or torture. With the healthcare system in shambles, the fear is that even if the war ends, Syrians will continue to die long after the bombing stops.